Did you know that complications during pregnancy, like high blood pressure and preeclampsia, can predict future cardiac risk, like cardiovascular disease and even stroke? For many women, pregnancy is your first warning sign of cardiovascular disease, but most people don't realize this, and many people are not told. Today, you are going to learn what the recent evidence shows and all you need to know to advocate for your care. I'm Dr. Lora, Shahine, a double board-certified OBGYN and reproductive endocrinologist helping people build families and care for pregnancies for over 20 years. I love educating. If this is your first time finding the channel, welcome. Be sure and subscribe so you get my weekly videos all about reproductive health. If you have found content valuable and you're coming back for more, thank you. That is so exciting. I'm glad you're here. There are two other ways to learn and stay in touch. Number one, you can sign up for my weekly newsletter, link in the description below. You get updates, tips, fertility in the news. And the second is my weekly Brave and Curious podcast. You can listen anywhere you listen to podcasts, and you can see video interviews with experts in the field of fertility and wellness here on my YouTube channel under the Brave and Curious podcast playlist. Now, today we're talking all about preeclampsia, high blood pressure in pregnancy, and how it can predict future cardiac disease. Learning this is going to help you advocate for your care to decrease your future risk. Pregnancy is often treated as a chapter in a woman's health history. Have the baby healthy, mom healthy. Even if it was complicated, chapter is done and move on with your life. But recent evidence has really shown that some things that happen in pregnancy, like high blood pressure of pregnancy, preeclampsia of pregnancy, can predict future cardiovascular risks. And learning this can help you live healthier and have decreased risk in the future for your cardiovascular health. Today, we're going to go over four main topics. Topic number one, we're going to review hypertensive disease in pregnancy, definitions. Number two, we're going to go over just how common this is and what risk factors people may have to develop hypertensive disease in pregnancy. Topic number three, we're going to go over the evidence that shows that having these complications in pregnancy can predict future cardiovascular risks. And topic number four, we're going to put all this information together, and I'm going to give you tips on how to advocate for your care and decrease your risks of these poor outcomes if you know you are at risk for them. Let's get started. Topic number one, hypertensive disease in pregnancy. Now, this can be one of three things. It can be number one, chronic hypertension. Number two, gestational hypertension. And number three, the most serious is pre-eclampsia. So chronic hypertension, people can have hypertension before they're pregnant. It can be treated, monitored, and managed throughout the pregnancy. Then people can actually develop gestational hypertension. So it's usually after 20 weeks of pregnancy, blood pressures go up, it's diagnosed and monitored throughout the pregnancy. But the most serious form of hypertensive disease in pregnancy is pre-eclampsia. So this is high blood pressure in pregnancy after 20 weeks of gestation associated with other complications. These other complications can involve other organs in the body, like having protein in the urine. You can have poor liver function. You can have poor kidney function. You can develop headaches, low platelets, and even vision changes. This condition isn't just about high blood pressure. This is reflecting inflammation and stress with blood vessels throughout the body. Why does this matter in pregnancy? Because preeclampsia especially can be associated with serious poor outcomes like seizures in pregnancies, placental complications, preterm delivery, and even growth restriction for the baby. For the longest time in medicine, we thought the story ended there. Figure out the safest time to deliver the baby to keep baby and mom safe, and then end of story, preeclampsia is treated and finished, and go on healthy mom, healthy baby. But now we've learned so much more. Topic number two, how common is preeclampsia and hypertensive disease of pregnancy, and what are risk factors? Hypertensive disorders impact about 15% of all pregnancies. That's about 1 in 7 pregnancies. I can think of 8 risk factors that put somebody at higher risk of developing preeclampsia. Number 1, first pregnancy. Number 2, a previous pregnancy with preeclampsia. Number 3, chronic hypertension. So someone coming into a pregnancy knowing they have high blood pressure. Number 4, diabetes and insulin resistance. Number 5, obesity. Number 6, autoimmune disease. Number 7, family history of preeclampsia or hypertensive disorders in pregnancy. And finally, a pregnancy with multiple gestations like twins, triplets, or more is higher risk. Importantly, many women who develop preeclampsia and hypertension in pregnancy have no risk factors. Topic number 3, what does the research show? There is an incredible review article. It came out in 2021 from the American Heart Association. The journal is Hypertension. And it was really combining a lot of data from a lot of different studies looking at high blood pressure and preeclampsia in pregnancy and risk of future cardiac health. It is pretty incredible, some of the information that they found from combining a lot of information from a lot of different studies. The authors found that compared to women who had normal blood pressure in pregnancy, women who had high blood pressure and preeclampsia in pregnancy had a much higher risk of these outcomes in the future. 4 times higher risk of heart failure, 2 times higher risk of stroke, and 2 times higher risk of ischemic heart disease. Something that was really surprising is that the timing of the risk was in the first 10 years after delivery. So you think about heart disease happening in midlife or even in seniors, certainly after the age of 60, age of 65. But women are delivering babies in their 30s, 20s, maybe 40s. And these women are having these heart conditions happen within 10 years of delivery, which is much younger than what you would expect for most people presenting with heart disease. The authors talk about high blood pressure pregnancy being sort of a stress test on the body and maybe even causing some inflammation within blood vessels around the body that's putting people at a higher risk at a much younger age. The authors highlight one prospective study that showed that 23% of patients with pre-eclampsia had stage B heart failure by 1 year postpartum. That is shocking. The authors also looked at long-term risk of high blood pressure, so not just these cardiac events that are so scary, but just the risk of having high blood pressure in the future. And women who have high blood pressure in pregnancy are about 4 times higher risk of having high blood pressure about a year after they deliver, and almost 2 times higher risk at 10 and 20 years postpartum. So it's really shocking if you think about pregnancy care and postpartum. Most people just get 1 6-week postpartum visit. And at that visit, it's 10 minutes with your doctor and you get some vital signs and you are really asked about how's the baby doing? How is, nursing going if you're doing that? How's the baby feeding? Are you getting any sleep? How are you feeling? And it's not a lot of time to educate and really look for these risk factors. So I think a lot of women are going to be lost in the cracks and we're going to be missing valuable information from the delivery that could help us look for risks in the future and just help overall health. I'm really glad that you're learning about this. I'm glad that I'm learning about this. And I'm just really hopeful that this information gets out there because I think that we can really, really help people have healthier lives and have less cardiac disease if we just know what risk factors to look for. So bottom line, a history of high blood pressure or preeclampsia in pregnancy is not just a pregnancy problem. This is a warning sign for people to get more screening and more checkups and look for cardiovascular risk in the future. So topic number 4, now that you know this, what can you do about it? I've got 4 ideas. Number 1, if you have high blood pressure in pregnancy or preeclampsia in the past, tell every doctor that you see that you had this. So if you're presenting to the emergency room with right shoulder pain, that doctor should know that you had preeclampsia in pregnancy and that you can say, hey, I'm at higher risk of cardiovascular issues because I had this risk in pregnancy. Now, most doctors are not going to put that together. And so it's important to kind of inform your doctors. I know that burden shouldn't be on the patient. But I think even when you see primary care doctors, you're seeing your gynecologist, when someone says, hey, do you have any health issues? We're so quick to say no, but you should say, well, no, I don't. I'm not taking any medication right now. I don't have asthma or chronic issues that I'm treating right now, but I did have a complicated pregnancy. I had high blood pressure pregnancy. I had preeclampsia, and I know that puts me at higher risk of cardiovascular disease now. And hopefully the doctor will, listen. And I just think every doctor should be aware. Number 2 thing that you can do is get regular screening. So you should see a doctor about once a year. It's checking your vital signs, it's doing blood work, it's checking in and making sure that everything is okay. Like being active participant in your care and preventative health is only going to help us pick up on things sooner. Number 3, focus on your cardiovascular health. And you should be doing this whether you've had preeclampsia or hypertension in your pregnancy or not. But you should be thinking about your nutrition, your sleep, your exercise, your mental health, your stress management. All of these things are extremely important. Think about habits that you should not do that could harm your cardiovascular health, like tobacco, vaping, too much alcohol, too much marijuana. So thinking about your overall health and well-being is going to be even more important if you have high blood pressure or preeclampsia in pregnancy, because you are in a different risk category. And finally, recommendation number 4 is don't put yourself last. It is so easy to be a young mom and to think about everybody else's needs in the family except yours. It's what we are conditioned to do in society, but your needs, your health matters. And I just want to empower you with this knowledge that you know that risk factor is out there. I don't want that to scare you. I want it to encourage you to take good care of yourself, to communicate with your doctors, and to advocate for checkups and your wellness. Let's recap. High blood pressure, hypertensive disease in pregnancy occurs about 15% of the time, or 1 in 7 pregnancies. Amazing research has come out to show that preeclampsia is not just a pregnancy-related issue. It can be a warning sign to inflammation and damage in blood vessels that could put you at higher risk of cardiovascular disease in the future. This is not meant to scare you. This is meant to empower you so that you can communicate and advocate with your doctors about your increased cardiovascular risk, and you can take measures in your own day-to-day life in nutrition, sleep, stress management, exercise, and wellness, and getting rid of some poor health habits, adopting healthy health habits to decrease your risk and increase your wellness throughout your life. I really hope that you find this information empowering. Please share this with a loved one or anyone that you know that might be interested in learning about this association of hypertensive disease in pregnancy and future cardiac risk. You could really help your loved ones with sharing this information. I'm so glad that you're here. Like this video if you've learned something. Comment with questions that you have. Be sure and subscribe to this channel so you don't miss my weekly videos all about reproductive health. And until next week, stay brave and curious.